Hi, I'm Lauren.
And I'm Sophia.
And I'm Craig, and we're going to talk to you about technology and nursing informatics and what the future entails for us.
Okay, we're going to start off with a brief history of nursing informatics. First, I'm going to talk about Florence Nightingale. As we know, she is the founder of modern nursing, and she also used statistics to describe causes of mortality during the Crimean War. She used a pie chart to present her data, which was a very unusual and innovative method for that time period, and she called this pie chart Cox-Combs. These statistical methods she used were the first form of informatics used in the field. And now we can see the use of these processes in computer systems and other technology in the field of nursing today. Next, we're going to move on to the 1950s, and this is where we see Harriet Worley. She was the first designated nurse researcher at the Walter Reed Army Research Institute. She was asked by IBM to offer her thoughts regarding the use of computers in healthcare. And consistent with Florence Nightingale's ideas, she believed that the use of this technology in healthcare would greatly improve the quality of care brought to patients. Now for the 1970s, this was the development of the first all-inclusive health information system that would allow nurses to plan, document, and obtain feedback. And the nurses gathered at the El Camino Hospital in California. Also during this time period, we see Rita Zielsdorf, which is another nurse, and she contributed her nursing perspective on a number of up-and-coming medical projects, including the first paperless physician order entry and medication administration record with significant decision support, an automated record system for nurse practitioners in ambulatory care, and a multidisciplinary computer-based record for long-term care and research. Also in the 1970s, investigators at the University of Michigan met to formulate examples of nursing diagnoses, and they were inspired by the use of the technology that Rita Zielsdorf contributed to. And this helped pave the way for establishment of NANDA in 1973, in which they developed a preliminary set of 37 nursing diagnoses. Moving on to the 1980s, we see the introduction of the personal computer in 1980, which facilitated small-scale prototyping of nursing informatics applications. Also, Harriet Worley again and Norma Lang assembled a conference to develop a nursing minimum data set in which 4 nursing elements were identified: nursing diagnosis, nursing intervention, nursing outcome, and intensity of nursing care. Meanwhile, during this period, NANDA continued to meet and develop more nursing diagnoses. Also in the 1980s, the American Nurses Association and the National League for Nursing were actively involved in promoting nursing informatics, both nationally and globally. And in 1988, the University of Maryland opened its first graduate program in nursing informatics. The following year, in 1989, Judith Graves and Sheila Corcoran published their paper defining nursing informatics as a scientific discipline uniting nursing science, information science, and computer science to manage and process nursing data, information, and knowledge in support of nursing practice. Moving on to the 1990s, we have the development of the internet and web-based applications. Computers were also becoming smaller, more efficient, and lighter, facilitating healthcare workers to take laptops and PDAs to the patient's bedside for more accurate and faster recording of information. And in 1995, we see that nursing informatics was established as an area of specialty practice. Also, additional graduate programs were emerging in multiple universities throughout the nation as nursing informatics continued to grow. In the 2000s, nursing informatics continued to gain importance. In 2004, President George W. Bush announced the need for every person in the nation to have an electronic medical record by the year 2014. Also, a nurse, Nancy Staggers, said that ongoing research in nurse-computer interactions provides insights into usability of systems in distracting, complex clinical environments.
Good morning, Ms. Blunt.
morning.
My name is Craig. I'm going to be your nurse today. All right, so I'm just going to kind of ask you a couple questions. All right. So how are you feeling today?
I feel a little bit sick.
You feel a little bit sick? Are you any pain at all?
No, my throat kind of hurts a little bit.
Your throat kind of hurts a little bit. All right, anything else?
I feel like I have the chills.
Just, well, I mean, we don't have any sheets for you. I mean, we're in the past, we don't have any washers or anything like that, so we couldn't do the laundry. I'm sorry about that. Well, actually, due to our lack of technology, all I could find to assess you with is a stick. And it's a little bit dull for my last patient, so I'm just going to sharpen it up real quick if you don't mind. Is that fine with you?
I guess.
Or I could just use a knife if you like. Let me just sharpen this up here real quick. Alright, that's good. Okay, so what we're going to do is I'm just going to kind of poke you around with the stick a little bit and see if we can figure out what's wrong with you, okay?
Okay.
But I have to go check on another patient, and I will be back to do this, alright?
Okay.
Alright, well, thank you so much.
Thanks. The present day function of technology. Health information technology consists of tools that allow comprehensive, timely, and secure access to and management of medical information by both providers and consumers. Technology today is used in education, in healthcare providers, and also in patients. It's used in practice by healthcare providers. And there are unfortunately problems with technology that we have, and as it is used in hospitals and other healthcare fields. Healthcare provider education. Different mediums are used for teaching and learning. There are online courses, competency training, distance education. Advantages of this is that programs can be used again and again for learning. People in remote areas can get high quality education. There's also disadvantages, is the ability to ask questions is not always there with e-learning. Patient education and informing. Patients can access healthcare information without ever having to go to the hospital. They can get this information off of computer or off of websites or things like that. Websites like WebMD have allowed people to research and become more educated on topics of interest or their own personal diagnoses. Disadvantages of this is that patients can be misinformed and should not replace a website with a healthcare provider. Technology in practice. Client communication can be enhanced with technology. Patient records can be accessed much easier, and healthcare providers can chart and access the chart using technology. Communication. Healthcare providers and clients can communicate with each other through email, text, Skype, and also with phone calls. Nurses can communicate with other physicians, clients, and other nurses, whether they are in the same hospital or across town or across the world. This is becoming a very good advantage for healthcare because it saves time and can save the hassle of commuting. Here's an example of an online meeting using Microsoft Office Live. As you can see, there are different healthcare providers, a physician, and also nurses involved and looking at this patient's chart or their x-rays, and they are basically comparing notes and possibly coming up with a better plan to help this patient heal and have a better quality of care. Patient records. Electronic records are becoming more and more popular. Part of the healthcare reform bill is that all healthcare facilities will switch to electronic records. Advantages of this is it is easy to access for healthcare providers. The information is there when needed and easily accessible. Some disadvantages to this are that confidentiality can be broken if it is not taken care of, and if the information does not have passcodes or things that protect that. Charting. Facilities are using electronic charting. This is another way that technology has increased accessibility of information. Electronic charting also allows multiple healthcare providers to access the chart and update it with pertinent information that might have taken longer to enter into the chart and to let other healthcare providers know what was going on with the patient. But now that we are using electronic methods, the access of this information is becoming much more rapid. There are problems associated with technology in the healthcare field. Accessibility is one. Not all people have the latest and greatest software, and this can make it difficult for someone to open a document if they have an old operating system and it was created using a new operating system. It doesn't always work out for the patient. People are also not always comfortable with computers. An older generation is often not computer savvy or internet savvy, and they can become very frustrated when trying to access documents or healthcare information on the computer. Limited opportunity to ask questions can also be another problem. Instead of being able to just look up and ask your physician or your nurse a question, if you're sitting in front of a computer, there might not be an opportunity to do that. Technology is useful in education and in practice. The future of healthcare technology is always expanding. The opportunities are endless.